Managing seizures in young adults with ASD. Living with seizures can be challenging enough, but for young adults with autism spectrum disorder, the journey can be even more complex. The unpredictable nature of seizures combined with the sensory sensitivities and communication difficulties often associated with ASD can significantly impact their quality of life. Managing seizures involves a combination of medical treatment, lifestyle adjustments, and supportive measures. We're going to explore a holistic approach to managing seizures, empowering patients and their families with the knowledge and tools they need. Let's get started. Medical management. The cornerstone of seizure management often involves anti-epileptic drugs, or AEDs. Finding the right medication and dosage is crucial, and often involves close monitoring by a neurologist. Regular checkups and EEG monitoring are essential to assess the effectiveness of the medication. In some cases, when medication alone doesn't provide sufficient seizure control, a procedure called vagus nerve stimulation, or VNS, may be considered. Discuss all potential benefits and risks of each treatment option with your healthcare provider.
Living with seizures can be challenging enough, but for young adults with autism spectrum disorder, the journey can be even more complex. The unpredictable nature of seizures, combined with the sensory sensitivities and communication difficulties often associated with ASD, can significantly impact their quality of life.
Lifestyle adjustments. While medical interventions are crucial, lifestyle adjustments play a significant role in managing seizures. Establishing a consistent routine is important. Regular sleep patterns, consistent meal times, and structured daily activities can help regulate the body's natural rhythms. Sleep hygiene is particularly crucial, as sleep deprivation is a known seizure trigger. Diet and nutrition also play a role in seizure management. Some individuals with epilepsy benefit from a ketogenic diet, which is high in fat and low in carbohydrates. Consult with a registered dietitian or neurologist to determine if this dietary approach is appropriate.
Creating a safe environment is paramount for individuals prone to seizures. This involves identifying and minimizing potential hazards at home, school, and work. Padding sharp corners, securing heavy objects, and using safety gates on stairs can help prevent injuries during a seizure. Water safety is also crucial. Individuals with seizure disorders should never swim alone and should always be supervised in or around water. Educate caregivers, family members, and teachers about seizure first aid.
Chapter 4. Behavioral and psychological support. Living with a seizure disorder can take an emotional toll on both the individual and their families. Therapy can provide individuals with coping mechanisms to manage anxiety, stress, and depression. Support groups can provide a safe and understanding space for individuals and families to connect and share experiences. Addressing the emotional well-being of the individual is just as important as addressing the physical symptoms of seizures.
Chapter 5. Education and awareness. Knowledge is power, especially when it comes to managing seizures. Educating the individual with ASD, their families, caregivers, and educators about seizures is crucial for effective management. Understanding the different types of seizures, their triggers, and how to respond during an episode is essential. It's also important to have a seizure action plan in place, outlining the steps to take in case of a seizure. Open communication between the individual, their family, and healthcare providers is vital for effective seizure management. Chapter 6. Alternative and complementary therapies. While conventional medical treatments form the foundation of seizure management, some individuals find benefit in exploring alternative and complementary therapies. Mindfulness techniques such as meditation and deep breathing exercises can help reduce stress and promote relaxation. Yoga, which combines physical postures, breathing exercises, and meditation, can also be beneficial. Biofeedback is another technique that teaches individuals to control certain bodily functions through relaxation techniques. Always consult with a healthcare professional before starting any new therapies. A holistic approach to seizure management. Navigating the world of seizures, especially for young adults with autism spectrum disorder, requires a comprehensive and compassionate approach. A multidisciplinary approach can provide a comprehensive and effective strategy for managing seizures in young adults with ASD. By addressing the medical, emotional, and social aspects of living with seizures, we can empower individuals with ASD to live fuller, more independent lives. Stay informed, stay prepared, and stay supported.